Good evening, everybody. We are live, and I want to remind everybody we are live both on LinkedIn and YouTube. For anybody who's looking to rewatch this or who's watching us, if you're joining us live right now, let us know you can hear us. We would greatly appreciate it. I'm very excited about tonight's guest because it's a pharmacy practice resident. But I'm going to let her introduce herself and tell us a little bit about herself. Um, many, majority of you will be going for pharmacy practice residency. So I'm really trying to have you guys just hear directly from them and what their year have been like and what they may be able to offer you some wisdom or just a do-over type of advice. Good evening, Vanessa. How are you?
Hello, I'm doing good. Thank you so much for doing this. I think this is a great opportunity to allow other people to learn. I this would have been very helpful to have known about this while I was in pharmacy school.
Thank
But
you.
to start off, my name is Vanessa Clergeau, and I am a practicing resident at Penn Medicine Princeton Medical Center. I graduated this year actually in May from University of Maryland, Baltimore School of Pharmacy, and
Okay.
it's been a journey. It's been a few months in, learning a lot and being challenged in many avenues, but I think it's a blessing and it's exciting to really to remind myself why I'm here. I want to be the best, I don't know, pharmacist that I can be to
Yeah.
really serve underserved communities. That's always been a passion prior to residency, and that's something that I've just been an honor just to really learn so many things to really provide the best care. So that's a
Uh,
little bit of my story.
yeah. And yay, Maryland. I get always excited every time I hear anybody who's a grad from a school of pharmacy in Maryland. I get very excited. So thank you. Thank you again for doing this. So what made you decide to pursue a residency?
Yeah, that's a good question. Um, so I would say, let me see. So I know, like, starting before pharmacy school, I knew I wanted to be in the medical field. And so, I think realizing how important medicine is, because I think beforehand I didn't even know what pharmacy was until like towards my latter end of my college years. I
Gotcha.
had a psychology major, and I realized just the power of medicine. So I was at a opioid clinic treatment where they were
Mm,
treating people with Suboxone, and a lot of the patients were just so thankful about
yeah.
how life changing it was, and just knowing even
Mm,
a beyond that, like a lot of my classmates or friends, how life changing they said medications were for them, whether it was
yeah.
antidepressants or stimulants, whatever the case may be. So I think that intrigued me to, okay, I think pharmacy is where it's at. I want to learn about medicine. I want to learn the pharmacology of it and counsel patients and let them know how is it helping them and common side effects. So then
Abs-
coming to pharmacy school, I ended up being more excited. Though it was strenuous, I think I enjoyed the knowledge I was gaining, just learning about the different modules, the disease
yeah.
state. But then I was deciding, okay, should I do industry? Because I think industry started popping up. And then so then I had to decide for what I really wanted. And I think
Mhm.
throughout rotations and throughout the modules, I realized, like, I think I'm more excited, and I would want to learn more about like the day-to-day being a clinician or practicing in the hospital setting or even in the clinic setting. So
Yeah.
then my last year was really what helped me, like going through the rotations, just a hands-on experience, the
Mhm.
patient interactions. It definitely was like, okay, yeah, I want to apply. So I think that what led me to applying to residencies, just to develop my clinical knowledge, and then whatever happens there, afterwards, it was up to there. But I think I wanted to really perfect my knowledge as much as I can. There's
Yeah.
always so much to learn.
Absolutely. So does that sound like you're not sure about a second year yet, or is that
Oh,
picture?
Oh, no. I think so starting residency right now, I'm learning so much. I want to start a second year. I want to specialize in either psych or ambulatory care. So
Yeah.
I don't know yet, but for the most part, I know I want to do like a in a clinical setting or in a,
Okay.
I don't know, like a outpatient clinic or even
Clinic.
a hospital setting. I'm open to either or. So I think like in terms of like learning as much knowledge as I can, I feel like being in the clinical setting will provide that for me. But that,
Absolutely.
I guess I'm talking about 20 years from now. I don't know what I'm doing afterwards. But for
Yeah.
now, I
Yeah.
think residency is really like looking hindsight. Hindsight is this is what I want to do just
Uh,
because of so much experience I've already gained and what I'm
yeah.
learning.
Yeah.
And I'm a learner. I love learning. So I think this is really what I wanted to do.
That's awesome. So then I think for the students that are early in their careers, the first and second year students are the ones that I tend to really focus on and putting things on their radar. What are some things that you think you'd say from your personal journey that you kind of did as a first or second year student, or even going through pharmacy school as a whole, that
Mhm.
helped prepare you to be a competitive candidate for residency?
Yeah. Okay. So I would say, so definitely starting your first year because I think there was a lot of options. So I
Yeah.
think it could be very overwhelming, like a lot of like clubs, a lot of organizations. So I would say take it slow for at least the first semester because I think it's new, right? There's a lot of classes you're taking. You're trying to figure out your study habits, your studying style, and then you have all these organizations that everyone is just, marketing themselves. And then at this point, you don't even know what you want to get into. So I
Mhm.
would say, I think starting off, if I had to like to give an advice, would to start slow, but dibble dabble in what you can,
Yeah.
maximize your time.
Mhm.
I wouldn't say not to attend any of these organizations. I think a lot of the organizations provided great, like, what was it, round tables where residents would come in and
Mhm.
talk about their day-to-day lifestyles.
Mhm.
It would be informational topics. I tried to learn as many different fields of pharmacy as much as I could in the beginning to really, I guess, expose myself. So I would go to these conferences that was part of the organizations, and I would try to. I didn't. I went to one of the APHA conferences and learned about industry. Didn't even know about that before pharmacy. So I think explore as many options as you can so you can figure out what you want instead of going to, like, I guess what's popular. Everybody wants to do
Yeah.
residency, everybody wants to do industry, but really figure out what you want to do. And some
Yeah.
of them have like hands-on experiences, like you could do counseling sessions and
Yeah.
competitions and take up these opportunities. Even it's so many opportunities you could take with these organizations
Mhm.
that like you miss probably through emails or overload of advertisements. If you take the day to look through what's going on throughout the week and try to attend some of them as much as you can, that
Mhm.
would, one, give you a baseline. And I think
Absolutely.
moving forward, figuring out how do you feel when you're learning these materials besides like stress
Yeah.
or being overwhelmed. Uh,
Right.
some of these courses, a lot of my classmates realize, oh wow, this is what I want. I
Yeah.
think we're taking health policy, some of the disease states and how we were interacting in the group. What was it? The law, a lot
Yeah.
of them, they realize, okay, this is what I want to do just because of attending these classes,
Mhm.
asking questions, talking to the professors. I'm all about like harassing people that you want to be like,
Yes.
um, like they're I could see the fear, going up to
Yeah.
people, but when you're hungry and you really want to learn, I'm
Yeah.
pretty sure you're gonna appreciate it. So
They do.
take
They
up that
do.
opportunity to talk to them. And then so with building your CV, like I said, eventually you'll realize what you want to do. So you'll commit to at least one or two organization that you feel like you could commit yourself to and build
Absolutely.
a repertoire with that. So with that, I would get these leadership skills and then had so many experiences to even talk about that during residency.
Yeah.
A lot of outreach opportunities
Mhm.
and ask for projects, like if you're able to do research opportunities with these
Mhm,
faculty, they're so open. They want someone to do something with them. They have all
mhm,
these ideas that they want students to work on. Do like you'll realize that, like, I think a fear of mine at one point, I was like, am I doing enough? You'll
mhm,
realize, like, I don't know, everyone is different in their own way, but I think at
mhm.
some point I felt like I wasn't doing enough. But that
Yeah,
enough, it spoke volumes during interviews because you could tell when someone's excited. You could
yeah,
tell, like, wow, you gained a lot of opportunities through that, gained
yeah,
a lot of skills. With that little, you could do so much. You just gotta,
absolutely.
like, volunteer more, do speak up, and push yourself out there and
Yeah.
taking up leadership opportunities. I would say, in a nutshell, that would really help build your CV.
CV. I think that's been like one of those major consistent things that a lot of people in postgraduate training have shared. Staying open to opportunities, finding what speaks to you, looking for mentors, not being afraid of rejection to the point where you limit yourself and not reach out to people who would otherwise love to be able to help you and guide you. So I think you're literally echoing some of those same themes. Um, about your program, where are you guys located and how many positions do you have open? Tell us a little bit about where you are.
Yeah. So I'm at Penn Medicine Princeton Medical Center. So it's in New Jersey, central New Jersey. But I know there's a debate that central may not exist.
Oh, really?
But that's a little, I don't know what's going on with that. But it's in central Jersey, the Princeton area. And so I think they recently, like, was owned by Penn Medicine. So we're a part of that, but in New Jersey. I know that was a bit confusing for people. I'm not
Mhm.
in Pennsylvania, but in New
No,
Jersey.
New Jersey.
Um, and so they offer a PGY1. So there's two positions. So it's me and my
Gotcha.
co-resident that's there currently, and then they offer one position for PGY2 in internal medicine.
Gotcha.
And so it's a general PGY1. So you have like a diverse of, like, rotations. Right now I'm in my psych rotation, which I'm really excited to be in right now. So the I guess the community is very suburban
Okay.
um community. There are several hospitals that's near it. That's more of like the city. I don't know if you heard of Robert Wood Johnson, but that's like not too far from that's like, I don't know, 20 minutes out. So some of
Okay.
the population is a bit different because I came from University of Maryland, so I was more in the city, and then so
Mhm.
going to more of a rural suburban area, it's a good to have like a mixture of that different population. Um,
Absolutely.
yeah, I would say, yeah. Right now, there's a lot of projects and audits that we're doing right now.
Yeah.
So,
Yeah,
um,
that brings me to like my next question. We are officially outside of that 90-day period for all of you now. What has your year been like so far?
I feel like it's been, like I said before, it's exciting, but challenging. So I think there's a lot of, it really teaches you, like, the basic things that, I don't know, we try to learn and master, but sometimes it can be hard. But like time management skills,
Mhm.
multitasking, but um, so some of the rotations I've had. So my first rotation was like internal medicine. So that's learning the Epic system, learning the hospital system in itself, but then also dealing with different disease states when you're internal medicine. So that was really exciting to learn that. And then learning certain aspects of, like, let's say IV training
Yeah.
or whatnot, and then administration, and then right now I'm in psych. So trying to do the rotations that I would like to do before mid-year, what's going on right now. Now we're preparing to pay for that and, getting ready for that showcase, which is so crazy to me.
Yeah,
But
because you feel like you just started, right?
it just did
Yeah.
that. Now I'm
Yeah.
doing it again. That is so crazy.
Yeah.
Um,
So you will be at mid-year.
yes, 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 yeah.
Very good. So for everybody out there, you can catch Vanessa and her co-resident at the ASHP residency showcase. I've been like plugging everybody, like, go visit, go say hi, go learn more in person. Wow,
Yes.
yeah. Mid-year seems like it's this thing that's really far away when you're just starting in summer. And then you blink and it's like, it's time to register for mid-year. You're like, what?
Yes. It is so
Oh, yeah.
crazy. It'll be crazy being on the other side, you know?
Yes. To be on the other side of it, it's a surreal experience because you're like, oh man, okay, we're those guys that they're interested in talking to now, and they want to hear from us, type thing. But
Yep.
it's cool. It's tiring, but it's like it's cool. Like I love meeting new people. So the
Mhm.
showcase was literally one of my favorite things to do that I did that year. Just
Wow.
engaging with different people, and people coming up, and you can tell people are super nervous. And I'm like, I don't know, I don't decide anything here. I'm just here to provide you information and what you want to know. So just like making them comfortable and disarming them that way. But I love speaking to people. So I enjoyed it, but like at first it was very overwhelming to be like, oh my God, I'm standing in front of this booth. Okay. And
It's
like, I guess we're doing this. Let's go. Um,
right. And
yeah.
then and the crazy thing is, it was virtual last year. So now
Yeah.
it being physical, like you're actually going there, I don't so I don't know how that's gonna be.
Yeah, it's gonna be, I think people are so excited. The energy is gonna be amazing.
Oh, I'm sure.
What do you believe you've noticed was or has been your toughest challenge or adjustment in switching from being a student to being a new practitioner?
Wow, yeah. Yep. I think imposter syndrome. It
Yeah.
is like it's something that I feel like I struggled even beforehand, because it's a blessing. I'm a first generation graduate student, the doctorate in
Yeah.
my family, and
Uh,
so I think
congrats.
so. Thank you. I think sometimes it doesn't feel real, and
Yeah.
then now, like I don't know, like it's exciting to be a learner, but now you're seeing other students that's in your rotation and you're like you're not a student. Yeah, I'm still learning and you're always learning, but in having to switch that confidence is it
Yeah.
I think it definitely was, a little bit difficult in the beginning, and I'm still struggling honestly right now, but
Yeah.
over time you'll realize it's gonna be okay. Like,
Yeah.
I think I could put a lot of pressure on myself. I want to learn everything, I want to know everything, but I think being reminded honestly by my RPD, who's amazing, and just my co-resident, we're saying we're taking it one day at a time. And
Good.
even the co-resident that's with us now, who's in PGY 2, but was in our position last year, she's
Yeah.
so comforting, just reminding us like she was in that same position and she felt a lot confident, especially by the end of the year. So I'm hoping, that confidence boost up, but I think imposter syndrome and believing that I'm meant to be here. I have to remind
Yeah.
myself I worked hard.
Yeah.
God allowed me to be here and I deserve to be here. And I gotta.
Yes. Please, please just shout it for the folks in the back of the room that maybe thought you whispered really low. You worked hard. Like this is not something that's going to fall in your lap.
Yeah.
You literally had to identify, plan, strategize, and execute flawlessly to get to where you are. Like, there's nothing accidental about landing a residency, right? So I think we really, really have to normalize like taking a beat and just looking at where we are and saying, yes, yes, I did that, and being comfortable with like how that makes you feel, because I think modesty, oh, you have to be modest, you have to be humble, you have to, all these things are super promoted in us to a degree where we don't celebrate our wins to the degree we should. So
Mhm.
I think that it's very profound, and yes, please bask in that a little bit. Like, you deserve this and you earn this. Like, it falls in no one's lap. It's why I have so much respect for people who make the decision and go through this process. And I just want to help more people realize that dream for themselves. And
Mm.
even that audacity to be like, I could totally do that, and having the courage to pursue it further. Um, you're going to be at the showcase. You're a two position program, and I'm totally coming to visit at mid year. I think I'm going to be the most exhausted person at mid year because I'm promising to come to everybody's booth to visit them.
Oh.
I'm gonna be so busy. I'm gonna be like on a tour to come see everybody. I wanted to ask you, like, as far as everything that you went through from your prep to a successful match, and the fact that like it didn't just end there. You had to work on getting licensed, as balancing all of that. What's
Mhm.
some wisdom that you've picked up along the way that you kind of want to share with others as they begin their journeys? Like, we are in the middle of October. It starts like it really, really starts in like
Yeah.
no time. So, what's some wisdom or something you've learned along the way you'd like to pass on to others?
Yeah, I would say, um, it's easier said than done. Procrastination.
Yes,
Don't do it.
don't do it.
Like I think preparing for residency, like applying the interviews, honestly was probably one of the most stressful moments of my life.
Yeah,
It was a lot of it was a lot of planning, and I
yeah,
think if I had to look in hindsight, I wish I would have started earlier. I think I was trying to figure things out, and as much as I love mentorship, I tried my best with getting one, but I think it was so I think I was navigating it as best as I could, going to as
yeah,
many residency like rounds or asking as many advice as I could.
yeah,
So if you have a mentor or you have someone who've been through the process, take advantage of that. I
yeah,
think it's been a lot smoother to figure things out, but it worked out. But I think planning, honestly, you can't let a day go by without planning what you're doing. Like,
yeah.
who you're thinking to write that letter recommendation for, a strong letter recommendation.
Strong.
You
Please
Yeah,
don't be shy about being specific about what
yes,
kind of letter you want.
exactly, emphasizing on that. And so being confident in who those people that you're asking, that they could speak the best on your part. Like they seen you
Mhm.
develop throughout your rotations or even throughout your career in pharmacy school.
See, yeah,
Getting as many, like you could get a diverse one, like anybody in your rotation, whoever you did research with, your
yeah,
boss. So making sure you're building that connection, because like I think I was a bit shy in the beginning,
yeah,
but honestly, talk to them. Like they won't bite. You're a great mentor, and I'm sure you can speak
yeah,
on your behalf and how amazing open armed you are. And I think a lot of people want to express like what they know and help
yeah,
everybody. So
everybody.
talk to as many people, ask as many advice, do your CV. Like honestly, I don't think I touched my CV until my last year, and it was stressful. Having so many people look over that CV. I think
Yeah,
over 15 was a lot of people that looked over it, and it
yeah,
ended up being great towards the end. But
yeah,
you'll
but
realize these are not simple assignments, like, or simple things that you're doing. These things are involving a lot of work, a lot of development, a lot of editing, changing. So it's not like oh, I'll give myself to complete this in a week. No, you're involving so many people, so it takes time.
takes
So
time.
start now if you haven't. Uh, please. And be confident. You'll realize you have to remind yourself why you're doing this,
Yeah,
because I think you could probably easily get burnt out in residency.
yeah,
Um, but you have to remember that you're capable of doing it.
mhm,
Look at the things you've done, and what
absolutely.
you've accomplished,
Yeah,
and you're gonna do it. I think I was very stressed with residency because you're competing with so many people in terms of the interviews. Like,
yeah,
why me? But at the end of the day, even spiritual or not, what's meant for you will come to you. And I think
right.
I thought before that was like I don't know, it's corny, but you'll realize
No,
it's
it's
gonna
not.
come to you.
Yes.
Just do your part,
Mhm.
believe it, be
Yeah,
confident, you'll get it. You'll get
you
it.
will, you
Ex
will.
I think during the interviews, it's important to show who you are
Yeah,
and then your passion.
mhm,
And then you'll see that during the interviews. And then
absolutely.
planning for licensing, the
Ah,
ATT.
girl,
Yeah, some of the
it's a
schools,
whole thing. It's like a whole thing. It's
a
like
whole thing. Literally. Ideally, I wanted to study during my rotations. If you could do that, please, that'd be great. Use your
Yeah.
NAFLEX book, all that stuff. But if you can't, life happens.
Yeah.
Soon as you graduate, have your fun, celebrate yourself, but get to studying so
Get
you
to
can just life
studying.
as soon as possible
Yes.
because it could be a lot
Yeah.
studying while you're in residency,
Yeah.
especially if you moved out of state, you're
Yeah.
adjusting with the new area. It literally could be a lot. So if you could do it as soon as possible, please do that. Yeah.
It's you've touched on so many great things. Like one of the things that like the students that I worked with through the process, they get so annoyed with me because I ask them that why are you doing this? Why are you doing a residency? I want a clarity of purpose statement. You need to be able to tell me in 3 to 5 sentences why are you doing this? Not not over 10 minutes, but in less than 2 minutes, if I ask you, why are you doing a residency? Why are you pursuing this? It needs to be so clear to me why you're choosing. It's a choice. We like to act like someone pressured us into it when we finally get there, but we made a conscious decision and said, this is what I want to do. And the only difference between the people who keep the mentality and keep pushing, it's that clarity of purpose because you have a guiding purpose. Like every time you think you're starting to flounder, you remember, why did I choose to do this again? Oh, right. I felt like I had more to offer. I wanted more training. My patients deserve the best. I want to be the next best this. I want go back to that thing and see how energized and motivated you are all over again. But when that's not clear, if you're just doing it because all your friends are doing it, December is going to come. You're going to be like, I thought I could, but nah, forget this. I'm good. You're not going to decide to go through with it. You will draw from the match because it just seems like way too much. So I love that you've touched on that because it's one of those things that it will carry you through. Residency is not easy. Um, Anybody who's honest will be honest with that number one fact. So I try not to lie to anybody. If you don't know why you're doing this, it's going to be a very, very treacherous journey for you. Right. So, thank you, Vanessa. Thank
Mhm.
you so much. Like, you're so funny. I absolutely will see you at midyear. I'm so excited that you will be there. I'm going to be on tour, just stopping by and saying hi to all of you. It'll be such a pleasure to finally meet you in person. But
Yes.
thank you. I'm so grateful for you to take the time this evening when I know your calendar is absolutely stacked. But we appreciate you stopping by and sharing your experiences and your wisdom with the up and coming folks. And is it okay if they reach out to you before I put it out there?
Oh, yes, please.
Okay,
Please.
cool. So feel free to reach out to Vanessa with your questions about the program or your questions for her specifically about her journey or just feedback. She just told you there was probably 15 people who saw her CV. So I think it's time for her to pay that forward. But watch your inbox blow up with 50 CVs. I'm sorry
Hey.
in advance. It's like, um, but people, we have to stop being afraid of the possibility of rejection. There are so many people out here that are really genuinely looking to contribute and help to your growth and development. It literally starts with a simple introduction and why you're reaching out. I can't I haven't heard any horror stories because if I did, trust me, I would tell you that the horror stories exist. But everybody who's reached out to someone, it's been super positive, and I'm very grateful. Vanessa, again, thank you so much. And God willing, I shall see you in December.
Amen. I'm
Uh,
looking forward to that. Thank
uh,
you so much again for doing this.
Absolutely. It's my pleasure. Thank you, everybody, for joining us. I believe that is it for this week. Next week, Monday, I'm so excited. We have our first RPD that's coming through. Send me your questions. She's so excited to answer all of them for you. So I'm so excited that we have an RPD that's actually that wants to step in here and talk to you guys. And she's super to the point. So I'm very excited that she's joining us. Have a wonderful evening and great weekend. Bye, Vanessa.
Bye. Bye, everyone.